Thank you, Donna. And what a great turnout today. This is really exciting and inspiring for me to see the energy in this room around this issue. Gabriela and I are going to talk a little bit today about what we're doing in partnership around Cleaner Air Oregon. And this is, as you know, a new initiative that is health-based, look at industrial air toxics in the state of Oregon. We're going to talk at you, but we're also here today, and our staff are here today to listen and learn, as much as, if not more so, than to talk at you. As we start this new program, we really have an opportunity here, not just around industrial air toxics, but to learn from you all and to learn from communities across Oregon how we better incorporate environmental justice concerns into programs at the Oregon Department of Environmental Quality as well as the Oregon Health Authority. So before getting into some of the specifics around Cleaner Air Oregon, though, we want to both give you a little bit of context for the discussion today around Cleaner Air Oregon. So I'm going to start out and then ask Gabriela to do the same with regard to the Oregon Health Authority. So most of you know that Oregon DEQ's mission is to be a leader in protecting and restoring the quality of Oregon's air, land, and water quality. But even more fundamentally, we do that not only to protect the environment, but also to protect human health. Oregon DEQ's work is science-based, but a key part of that and relevant to today's discussion is making sure that that science is accessible to the public and to environmental justice communities as we engage in important policy decisions about our programs. Oregon DEQ is fully committed to the partnership with Oregon Health Authority. This is something that I think deteriorated a bit over time, frankly, and I am very excited by the really strong partnership that we are building and the foundation we're laying for future work between our two agencies. I think that is an important part, frankly, for Oregon DEQ in terms of restoring public confidence and trust that we are doing what we need to do to protect public health in the state of Oregon. So in sum, I appreciate the opportunity to represent the department here today. Look forward to working with you today, but also over the course of the next year as we put this important program together. Gabriela?
Thank you, Richard. And so, you know, I'm going to provide some context, and then we're going to dive into some of the where we are in the process, in particular around Cleaner Air Oregon, which has been a catalyst, an important catalyst in the state. And I just want to echo the thanks for the invitation to participate today, and what a great energy and potential there is in this room. Not just potential; it already represents a measure of success. So this is very exciting. The State of Oregon, Oregon Health Authority, and the Public Health Division in particular, which is where the environmental public health program is housed, works to protect the health of all Oregonians and the communities they live, work, play, and learn in. A core belief within public health and for OHA is that everyone deserves the same opportunities to be healthy. We recognize, and we've heard already compellingly this morning, that communities of color and lower income communities do not have those same opportunities. That's the case when it comes to breathing air, clean air, but it's also the case for many other important areas of health. Like DEQ, OHA is a science-driven agency. We're science-based in our work. And there is evidence that the physical, psychological, and social stress of poverty and racism undermine the health of individuals and communities. Very specifically, we have studies that have found that undernourished children will absorb more lead from the air into their bones than well-nourished children. Similarly, there's other research that has shown that Black adults experience health effects of exposure to lead at lower levels than other populations. We've known and we've seen for decades that lower income communities and communities of color live near more sources of pollution and are therefore more likely to be exposed to higher levels of toxics. These individuals, together with sensitive populations such as children, the elderly, pregnant women, are at greater risk of experiencing respiratory, cardiac, and other health effects from exposure to toxics. And underscoring what Richard said, well, OHA and DEQ have had a long consultative relationship. For years, the experience of overhauling the state's framework, state's regulatory program for industrial air toxics is forging really an unprecedented level of collaboration between our two agencies, which we intend to build on. Specific to some of the work we do, we've deployed OHA's Environmental Health Assessment Program funded by the Centers for Disease Control to evaluate health risks at the different facilities where air monitoring has been conducted by DEQ. So places like Ouroboros Glass, Bullseye Glass, Precision Cast Parts, Ameritise Railroad tie manufacturing facility in the Dalles, we're in conversations regarding Hollywood and Bose facility in Corvallis. And as Tony mentioned earlier, we are working together with DEQ to help address air quality, and with Multnomah County to address air quality concerns in the Coley neighborhood. Most relevant to today's conversation is that OHA has brought public health toxicology, community engagement, and an environmental justice lens and best practices to the Cleaner Air Oregon rulemaking process, complementing DEQ's environmental science and regulatory expertise and DEQ's own background in environmental justice work. As government agencies, though, we cannot do this work alone. In this, as in so many contexts that raise health equity and environmental justice concerns, we really need our community partners. Harkening back to the kind of call to action that you heard from Ben Duncan this morning in terms of needing to stand up. I think, Ben, you were saying specifically in the federal context, but at the state context also, where you have the opportunity to raise a voice. We see this workshop as a really important step in developing and leveraging our partnerships with communities to advance environmental justice. And actually, Richard, I think you're going to talk a little bit more about air quality.
Sure. Thanks, Gabriela. So before getting into the details of the Cleaner Air Oregon program, I wanted to just set the stage a little bit by talking about a different type of context, which is sources of air toxics generally. The Cleaner Air Oregon program is focused on industrial sources of air toxics. But I think everybody in this room knows that there are many sources of air toxics, including principally transportation, not just cars and trucks, but also marine, rail, as well as construction equipment, paint and solvent use, home heating, wood stoves. We have a variety of sources of air toxics in Oregon and in our communities. So we acknowledge right up front that this program, although it's very important to get this done and take care of this slice of the pie, if you will, it is only one slice of the pie. I saw the poster boards in the back about diesel. There could be poster boards about wood smoke also. I want to encourage everybody in this room to participate at the state level, both with the agencies, but also, frankly, with the Oregon legislature, where your senator for this area, Senator Michael Dembrow, has been a real leader on diesel in particular, to participate in that dialogue as well. Because if we're truly concerned about public health in our communities, we need to be looking at the whole pie, not just this pie. Portion of the pie that we're going to talk about this morning. As Gabriela mentioned, coming back to industrial air toxics and the broader context, when you look at the cumulative effect of various sources of air toxics, they tend to be concentrated in communities that are close to transportation corridors and industrial areas as well. But also another type of concentration is in areas of lower income, particularly where people are relying and need to rely on cheaper sources of energy like wood stoves. So we're going to talk about that a little bit later when we talk about cumulative effects in more detail. I also want to make sure you're all aware that the state resources for this work are very limited. DEQ has a very limited number of monitors that are capable of measuring the metals and other air toxics that people are particularly concerned about. We have only 2 long-term trend sites in the state of Oregon, one in Portland and one in the city of LeGrand in eastern Oregon. We are currently seeking funding from the Oregon legislature for 6 additional long-term trend sites, including 3 here in the city of Portland. But that's anything but assured at this point. We're also going to need additional resources in order to have the monitoring specific to particular communities, particular clusters of industries, where we have those concerns about cumulative health effects. So I'm going to close, and then we'll get into the main meat of the presentation, just by noting that I don't think it's occurred yet, but later today we are expecting the federal administration to announce that they are reconsidering the action on standards for light-duty vehicles and trucks. So I mentioned diesel pollution. If people are really concerned about these issues, they need to be engaging at the state level, but also at the federal level on some of the things that are going on there, particularly this action on vehicle standards, which has the potential to make our job much harder in terms of what we're doing here in Oregon. So with that, I'm going to turn it back to Gabriela to do the first part of the presentation on the Cleaner Air Oregon program, and then I'll come in and clean up on some of the pieces at the end.
So just to get all of us on the same page, for those of you who may not have been following in excruciating detail the recent history of industrial air toxics in Oregon, I'm going to provide a very brief background about how the initiative came to overhaul the state's industrial air toxics regulations came about. In 2013, the Forest Service in 2013, the Forest Service contacted DEQ about conducting a project to study urban moss for pollution from vehicle emissions. And it's similar to research that they've done for a long time in national forests, where they're measuring the impact of urban areas on our national forests. DEQ, however, asked the Forest Service researchers to look for metals instead of vehicle emissions. And that's because DEQ had been, with the one monitor that Richard was talking about, had been measuring in the Portland airshed a level of cadmium in particular, I think probably other metals. Sarah Armitage here from DEQ knows it by heart, but had been measuring some metals and cadmium at this level, but the modeling of sources based on information from facilities indicated that it should be lower than that. And so, but DEQ didn't know where these emissions, metals emissions were coming from. By 2015, that research revealed hotspots around 2 art glass manufacturers, Vera Burroughs and in particular Bullseye Glass, where the moss had elevated levels of these metals, and in other areas as well, as Tony DeFalco mentioned. Now, this was groundbreaking research with no signs to connect what was in the moss to what people would be breathing. But it was compelling enough to have DEQ place a monitor, an air monitor near Bullseye, and that monitoring revealed high levels of metals, hazardous metals in the air. And this also revealed, very starkly, a significant gap in the state's regulation of industrial facilities. We had a tremendous crisis of public concern, and Governor Kate Brown, directed our 2 agencies to work together to overhaul the state system for regulating industrial sources of air toxics to align with health. Currently, the current situation, following federal law, Oregon's rules restrict pollution by imposing industry or technology-specific requirements. It's called a technology-based standard. So facility makes a widget using this substance and using a particular kind of process, and they emit a certain volume of emissions, and EPA gives us a recipe for some industries and some toxics, about 187 toxics, gives us a recipe for what that facility needs to do. Um, so, the rules do reduce many industrial air toxics emissions, but they don't cap the total amount of contaminants a facility may release. They don't restrict the concentration of pollutant based on the health risks posed to people nearby. So in other words, the current industrial air toxics regulations aren't designed to take into account the local impact of industrial pollution on human health. You'll hear more from Richard about the specific steps in the overhaul process, but I'll mention that as part of that process, DEQ and OHA researched in depth numerous air toxics permitting programs on the West Coast and nationally to inform development of the new program. There are basic elements that we found common to most industrial health risk-based programs around the country, including deciding who is the universe of which is the universe of facilities that those rules will apply to, what are the methods for screening emissions for potential risks to human health, what are the protocols for conducting a more in-depth assessment where the earlier screening indicates it's warranted, and then actions to decrease emissions over whatever allowable risk level has been determined. Most pertinent to today's conversation, the DEQ and OHA rules team has sought to identify ways to incorporate into the fabric of the new regulatory program approaches that account for elevated health risk to communities of color, people with low income, and sensitive populations, children, elderly, pregnant women, and others. When these populations are protected, everyone is protected. It's important to say no decisions have yet been made. We're still in the middle of a rulemaking advisory process that Richard is going to talk about. But that advisory committee has been presented detailed information about ways to address environmental justice concerns, such as considering cumulative impacts of multiple pollutants from a single facility, considering cumulative impacts of multiple facilities that are concentrated in the same area. I think another important resource that we have in the state that we've taken advantage of is consultation with the Environmental Justice Task Force that Ben Duncan chairs, sharing with them some of the early documents early on relating to environmental justice, and asking the task force to appoint a designee to participate in the rulemaking advisory committee. We are also, the two agencies, the Health Authority and DEQ, are engaged in a project to evaluate EPA's EJ Screen as a tool to inform and implement a tool to inform the implementation priorities, not only for Clean Air Oregon, but actually for the investment of the VW Diesel Trust Fund share that is going to come to Oregon in order to invest where the pollution burden has had the biggest impact. We are also participating in an effort led by Governor Brown's office to learn more about California's EnviroScreen tool for its possible usefulness, and with our own state's Geospatial Enterprise Office to improve Natural Resource Agency's use of geographic and demographic information related to environmental justice, which is highly relevant to implementation of the state's EJ statute. And so I guess I just wanted to recap and highlight, and that's what this slide speaks to, what we expect Cleaner Air Oregon will do. First, to set limits on toxic air emissions for industrial facilities based on impacts to human health. Second, to require evaluation of emissions and risks relative to health-based standards and potential health impacts. Third, to include a comprehensive screening of facilities that emit air toxics to allow a focus on where emissions need to be reduced to protect public health. Fourth, to give businesses clear direction and guidance on regulations. This will provide certainty and consistency about how they need to operate, both for the businesses and for communities. Clean Air Oregon will also consider the impact on businesses, jobs, and local economies, recognizing that employment is a significant determinant of health. In sum, Cleaner Air Oregon will improve air quality for people living near industrial facilities. And I'll turn it back over to Richard to explain where we are in the process and what the opportunities are going forward for engagement in that. Thank you.
Okay, thanks. All right. So I'm going to touch briefly on where we are and what we've been doing for the last year, really. One important step that we took starting in November of actually last year was to send out a request to all the air permittees in the state of Oregon asking for emissions inventory data. We don't currently have inventory data from many of the permittees in the state of Oregon. So this is an opportunity for the state to really get a comprehensive picture of what's out there in terms of at least potential emissions from a wide range of facilities in the state. And it's really a key step in the design of the program. So in terms of the pollutants that we've asked for an inventory of, it's also an extensive scope of pollutants that we've asked for. It's the 187 hazardous air pollutants that are regulated under federal law, but also Washington's list, California's list, and also Oregon has its own multimedia air toxics list. The information from the emissions inventory is going to be made available to the public. And we're working on some of that infrastructure right now. And the inventory is staggered over time, so the last reporting will come in September of this year. So process so far in terms of engagement, first of all, last spring in 2016, there were several webinars that were held to give people information about air toxics. There were then a series of technical work group meetings that were held during the summer that has laid a lot of the foundation technical work for this program. And then finally, there were 4 regional public forums in Medford, Bend, Pendleton, and Portland. Right now, we're in the middle of a Rules Advisory Committee process that started in October of last fall. The Rules Advisory Committee has 23 members representing a broad range of interest, including community and environmental justice interest, as well as other interests. So I just want to focus in a little bit on the main program elements that the Rules Advisory Committee is looking at right now. First of all, scope of the program in terms of what facilities are covered and what pollutants are covered, as well as setting risk-based concentrations. And again, looking not just at federal or state sources here in Oregon, but also looking at other existing programs around the nation. A key point in all of this program is making decisions about what are acceptable risk levels. And that gets very complicated, but I really want to underline that because that is really one of the main drivers and really, in some ways, the main policy issue in this rulemaking. We are looking at cumulative risk, both cumulative risk from multiple sources within a facility, from multiple pollutants, as well as multiple facility risk to an area. And I think that's going to be a very innovative, groundbreaking approach in Oregon's program. We're looking at various types of screens as a practical way of implementing the program. And finally, we all are also looking at what is realistic for the state to be able to implement. And frankly, where do we start? I'll signal right now, that's going to be a health-based decision. We are going to start in the areas that have the highest health risk, but exactly how you do that and what it means is complicated. So right now, in terms of upcoming steps, this summer, after the Rules Advisory Committee finishes its work, there will be a draft rule that is put out for public comment. And then in the fall and winter, we will be putting the emissions inventory information out and taking some other steps to engage with the public and communities as well. The formal part of the process is the decision maker here, or let me say one of the decision makers, is the Environmental Quality Commission, the policy board that oversees the Department of Environmental Quality. We'll be getting recommendations from staff, including the Health Authority, but there really is another sort of decision maker in the background here that I want to point out, and that's the Oregon legislature. I've mentioned resources necessary to implement this program a couple of times if we're really truly concerned about this issue. We are seeking funding in the Oregon legislature right now. And I'm just going to be direct, there has been some opposition to the funding for that program. And frankly, we could use your help in underlining the importance of this program to Oregon legislators. There will be a few other engagement steps. I want to particularly point out government-to-government consultation that will occur with Oregon tribes, as well as some additional engagement around environmental justice. So, excuse me? Thank you. So where are we in the process? We're in mid-March, and next week the framework for this program will be put out to the Rules Advisory Committee. This is a significant step in the process. It represents a beginning point for discussion by the Rules Advisory Committee and the broader community. This is by no means have decisions been made on any of this, but we have to start, at some point you have to start focusing the discussion, and this framework is the first piece of that. So people should be paying attention to that. It will be available on the website for Cleaner Air Oregon, and I encourage you all to not only look at it, but talk to us about your reaction to it. Both, there's the formal rulemaking process, but talk to us almost more importantly informally as we go forward on this work.
People can sign up on the website to get updates.
Thank you. So there is a sign up available on the website to get copies of the framework for those of you who are interested. So in sum, I want to thank Mr. Lee for being here today and sharing some of his expertise with us and the folks in the room, and look forward to working with him and others at EPA on this program, and hope that we can not only deliver really some important policy initiatives that protect the health of Oregon communities, but also help advance the dialogue nationally a little bit on these things. Thank you all very much.